The fibula is the more lateral of the two lower limb bones. It's a lot narrower and it's not a weight-bearing bone, but extensively its surface is used for muscle origin. So there's in fact 8 muscles that originate here. Now there's the head, which is the top part, which is slightly broader. There's a neck and obviously a shaft. The most inferior tip here is known as the lateral malleolus. And the lateral malleolus forms a very important joint called a mortise joint. So if I were to put the tibia and the fibula either side of the talus, you can see how they trap the talus in, and so they stabilize it and stop the ankle joint from shifting medial to lateral. So it's very important that the tibia and the fibula stay close together, otherwise the whole ankle stability is lost. So they're connected at a little joint here. So there's an articular surface, that smooth facet on the inner side of the fibula, which articulates with the tibia. And the tibia and the fibula are connected by the interosseous membrane. And they're also connected at the proximal end, you can see up there. So all of that together is known as the syndesmosis, and that keeps the tibia and the fibula together. If you have a look at the fibula at the neck end, this surface here, if you run your fingers down the lateral knee and push hard here, there's a nerve, and it can be quite unpleasant, and that's the common perineal nerve, or known as the fibular nerve. So fibula and perineal are essentially mean the same thing in terms of anatomy. The distal end of the fibula you can palpate just beneath your skin. It's very exposed, and because it's such a thin bone, it's very commonly fractured. So a lateral malleolar fracture is very common if the talus shifts suddenly. So if the talus shifts suddenly this way, it can smash the bottom of the fibula off. And depending on the level of the fibula fracture, depends whether we need to surgically correct the fracture. Because if the fracture involves the stability between the tibia and the fibula, then every time a patient weight bears, essentially the tibia and the fibula will be peeled apart by the talus pushing up into the articular surface here. So at times it needs surgical stability restored. The fibula, if you look at it in cross-section or in imaging, when it's sliced through this direction, it looks like a triangle. So just like the tibia has a very sharp interosseous border, the fibula also has a really sharp interosseous border. There's 3 borders. There's that one, the anterior border, and a sharp posterior border. And then there's 3 surfaces as well. So we have this anterior surface, medial surface, and a posterior surface. And the only other feature, apart from this lateral malleolus, something that sticks up, is a little apex. And the apex is what articulates with this lateral condyle of the tibia. So the apex is the bit that protrudes most proximally.